Okay, let's do our final lecture, everyone. So this is just a recap of lots of things that we've covered. So I'll go through quite quickly. We can go back through any of the lecture weeks to find out some more information. Our tutorial will also go through in a lot more detail and give you some examples and possible ways that you can tackle each of these main topics. So the exam is 4 questions, there's no choices, so you must answer all 4 questions. Some of the questions are quite broad and a couple of them are a little bit more specific. The first question is the scenario that I was talking about and it's worth 10 marks and you will need to apply a number of different elements and topics to it. Your second question is worth 8 marks and it has a number of elements to it. And questions 3 and 4 are a little bit more simplistic and each of those are just worth 6 marks. That brings it to a total of 30 marks for the exam. So the key topics that we covered, we started off by looking at assessment, then we wanted to look at how we map our assessment to our curriculum knowledge and plan appropriately for the children. We then wanted to make sure that we started with their interests and possibly planning after we've already taught. We engage in a range of assessment and reporting techniques. We make sure we create authentic learning opportunities. We understand the role and the elements of our quality practice. We make sure that we provide lots of multiple and varied learning experiences for the children, as well as engage in our strategies for early intervention and taking us through our reflective practice. So when we look at our cycle, we've got all of the essential elements that we are used to have with our ongoing evaluation staying as part of that constant reflective cycle that we have, making sure that we understand what we already know about the kids, how are you going to show that, what curriculum approaches will you use, what strategies, how and what will you assess, how are you going to document it all, and what does the information tell you, and therefore what will you need to tell parents? So our teaching and learning cycle is very complex and we need to take it all into account. So when we're thinking about it, evaluation is at the core and it's how we make sure that we're reflecting appropriately. So our first topic, we looked at the essential elements of assessment of, as and for learning. So when we look at assessment as learning, it's about our formative learning. We look at assessment for learning is also our formative and possibly our diagnostic, and our assessment of learning is our summative assessment. We make sure that our assessment is ongoing, systematic, and of course annotated to map to our needs and the student needs. Why do we assess? We do it to monitor their development. We look at our classroom planning and decision making. We make sure that we're meeting the specific needs of all of our children, and of course to report and communicate with others, whether that be people within our school or the wider community, parents, other stakeholders, and so on. So what are we actually assessing? We're assessing our growth and developmental domains, of course. We're making sure we're looking at what we've taught. We're gathering lots of information on their development. We're looking at the objectives and how we've gone through that process. We're looking at how the kids have shown us what they know. We're making sure that we're taking into account all the different contexts of the kids, and we're making sure that any problems and issues that we have got enough data, because we might identify something but we need to have the data to be able to validate it and to be able to talk to the other professionals with an informed point of view. So when we think about early childhood, our main type of assessment that we use is our observations. So observations really are our key method of assessment, and it's important because there's so many factors when we're thinking about our observations. So what do we do with them? We have to think about not just filing them away, but making sure that it's part of our data collection and part of what we do. So we make a plan of action based on our observations, and we use our observations to have those good critical discussions with others. Things that we must keep in mind with our assessments and our objectives provide a relationship that is how we define what we're teaching and whether the children have learnt it. Don't be confused with the what we are teaching as opposed to the pedagogy of teaching, as opposed to what the children have learnt. Assessment looks at what they have learnt and demonstrated. Our objectives are what we're hoping that they will learn. And we need to make sure that we have the core elements between it with our teaching and our processes and our ways of finding out what they know. Organisation. We have to think, how are we going to record? What are we going to record? Where are we going to put it? All of those sorts of things. And of course, making sure that it's not just done once or twice a term, but it's very regular depending on the children, the things that we want to assess, and so on. When we're assessing, we need to make sure that we are very objective. Now, this is really hard when we're working in early childhood because we get to know our little people so well. So you want to avoid labeling things and saying, oh, they have autism, therefore that's why they're doing that. No, you need to be able to identify it. Yes, definitely a label or a category gives us a reason potentially, but I often see things that are labelled as whatever is the diagnosis that the child has, but we actually need to go further than that. We need to work out what we can work with and avoid just putting them into a particular category. Oftentimes I will see some quite negative behaviour that is explained away and allowed, whereas it actually shouldn't. Just because they have a diagnosis doesn't mean they can get away with certain behaviours. And conversely, just because they're a bright little button doesn't mean that they should get away with being a nasty Nelly in the classroom. So you need to make sure that you are avoiding those stereotypes and making sure that we have authentic assessment and that we are very objective in both the recording and the collecting of the information. We make sure that we are very confidential. You will have your trusted people that you'll be able to talk to, and part of those should be your admin team. You are the person in the position of trust. We need to make sure that we are not chatting away to other parents about children that are in our class. Even though we might wish to, we shouldn't. You shouldn't disclose a diagnosis of any sort to any other parent. If a parent says, oh, I was speaking to so-and-so's and they said, that's different, but you don't go and disclose any of those sorts of things. So how do you know what, how, and why to assess? So you've got to look at what you're going to assess, how you're going to assess it, and then how you're going to document it. So you think about that reporting. Is it going to be formal or informal? How are you going to make sure that you're prepared to do those observations? So you might need to set up your EA to be looking after some children so that you can have some time to yourself and so on. You'll decide how you're going to report and you'll decide on your plan of action. We then had to go through the process in our class about looking at our philosophy. Our philosophy is where we take our core beliefs and we look at our vision statement and our mission about it. And we think about, what do we really believe? So then our philosophy then starts to determine our planning. And our planning is usually an administrative requirement within a school. It's our guide to action and what we're going to do. It really is, in early years or any classroom, an essential element. It's how we know our plan of what we're going to be doing, so then we can approach it differently depending on the students and what we want to have happen in our school. Our different levels of planning, if we look at the very top levels, we've got our school and centre planning, and you even have higher than that where you've got your system level planning. Then you've got your room or your year level curriculum. You then break that down into your term programs based around your learning areas or domains. You then work it down into your daily work pad, and then you decide what you're going to do for each activity in each learning area. So when we think about those, starting at the top are our yearly long-term plans, moving all the way down into our very short-term plans. Now, as we said, your objectives and your assessment must link together. So when you're doing your planning, you want to make sure that you're thinking ahead, but you're also constantly assessing. So don't go down the pathway that a lot of teachers do, where they do really over-plan things. It's better to go a little bit deeper and to make sure that you are covering things well, rather than trying to do that scattergun approach and trying to cover too many things. They need to learn and practice their skills. Don't think they have to have something new every day and every moment. Let them rehearse things in different ways. So when we decide what we're going to teach, you've got your observations and assessments that will guide you. You've got your curriculum that is determined from SCASA or other places. You've got your kindy guidelines, if we're working in our kindies. And you have, of course, our early years learning framework that determines what we're going to teach. And remember, always start from the strength-based perspective rather than going with, these are the things that children can't do, that's what I'll have to plan for. Go with, these are the things the students love. I know these are the things they have a bit of difficulty with. Let's work with all of that together, not just going with what they can't do and starting from there. So when we choose an approach, remember that whatever approach you choose, it should always align with your personal philosophy. And that's really tricky in some schools, particularly if your personal philosophy is a very play-based philosophy, but you're working in a school that's a lot more formalized. You have to work out how are you going to make that work. So part of that is understanding each of our different approaches. So these are the approaches that we explored in a different variety of depth. We looked at our mandatory approach, our integrated, our Correggio, our project approach, inquiry, anti-bias, Montessori, play-based, and our Walker learning approach. When we thought about our planning for our little people, we looked at whichever was our process that we wanted to use, and then we thought about how we could make that as a center with the child, and then all the way around it becomes all of our different elements that we look at. So when we're planning for very young children, we don't have those same curriculum documents. We have to think about it differently. So we look at caregiving as curriculum. So we look at the great routines that we can set up, the rituals that we organize, and of course our daily schedules. We make sure that we think about how we create good transitions, how we group our children, and how we ensure that we have consistency of staff so that we can have good bonding with our children. Our attachment as curriculum. Research really highlights the importance of that developing appropriate attachments as the baby, and the correlation to those positive achievements and success depends on having those good, secure attachments. So we know that good attachment is the development of a positive self-concept. It creates really good emotional stability, and we know that it increases the resilience of the child. So those primary attachments and secondary attachments are all important. And when you're working in a childcare setting, you might become the secondary attachment. Sometimes you might even be the primary attachment that we have, depending on the child and their home experiences that they have. So attachment curriculum looks at that importance of our home and centre transitions. It values those positive routine developments at drop-off times, pick-up times, that linking between everything, and making sure that we are really including families in it. So always think about the routines that you set up. You as the educator in that room or that centre, you are the person setting up those routines. So you want to minimise anxiety, you want to maximise the potential for bonding, you want to create those beautiful experiences. And then, of course, one of our core things that we have in our early years is making sure we have play as our curriculum. So understanding our different play types, our characteristics of play, and the range of experiences, so that then we can build them into our planning. So different centres, we've talked about how they will have different expectations regarding your planning. All of the formats will have something similar to these. They're going to have some goals and objectives. They're going to have ideas of how they'll collaborate with the family, which might be from a technical point of view of some iPad apps or something like that. They'll have, every centre will have links to your early years learning framework. They're going to be based on things that the kids love. So you have to think, what's your planning going to look like? And the centre will determine a lot of that. Now, always when we are thinking about our planning and our practical implementations, we want to make sure that we are always reflecting on what we do and how we do it. So it gives us advice about our past practice to inform our future practice. We want to make sure that we are always looking to make things better. So what is our quality improvement processes? We want to make sure that we are evaluating every element, not just one aspect. So evaluation means that we look at how we've impacted on the children's learning, yes, but also how we've impacted on all of the domains as well, making sure that we've created positive impacts with the parent community or with the different caregivers or with our wider community and so on. You're always trying to work out what are the right questions to ask and how you're going to answer them. So reflective practice is absolutely crucial in the work that we are doing in our classroom. So that gives you a quick summary of all of the things that we have covered. What we'll do in our tutorial is that we will take a number of topics and we'll have a shared document. Each group will have a different set of questions that they will have to look at, and then we'll have a created shared set of notes that will then be able to use for your exam preparation. So all of the notes will be useful and you'll be able to find some relevant research to map it, some relevant references to be able to back up some of your statements. So we'll talk more in our tutorials, but thank you so much for a fabulous semester and I'll see you in class.